Okay, so I'm professor of neurology, and I've been practicing for nearly 39 years now. And I've been teaching in different medical colleges, and I've done a lot of international work. In fact, I've been visiting Zambia for the last almost a decade now, doing charity work, doing a few programs, teaching medical schools there, and then seeing patients as well. And it's a great opportunity actually to be here, and we have very good friends in Africa, all over Africa. In Northern Africa, we have Professor Najib here. We have Mehndi Rata from India. I've been associated with him for the last 20 years. So it's always good to be with friends and colleagues from Africa, the whole of Africa and Asia. So should we start this session?
No, not yet. We're waiting for the group. So, Dr.
Yes,
Edel, if you can introduce yourself.
Fair enough.
Okay. Yeah. Thank you so much. I'm Professor Atidal Ibrahim from Sudan, Khartoum. I'm working as professors in the University of Al-Nilain University, Faculty of Medicine. I'm working as a neurologist and professor of neurology and medicine. And also a dean of Faculty of Medicine, Sudan University of Technology and Science. I'm working in Khartoum at the National Center for Neurological Science. I have an experience of works about 20 years experience. Okay.
Good morning from the Ghana High Commission. I join earlier speakers to acknowledge all distinguished personalities on this platform and to say how grateful I am to be part of this very internationally based and professionals and professors and doctors in their own field and respects. I have so far been enlightened on the issue of epilepsy, and I'm most grateful. I'm not certain if we have any expert from Ghana yet, but you'll be able to say. I'll be speaking mainly from the policy aspect, as I practically have no idea about what medicine is about. I bring a warm regards from the High Commissioner of Ghana to the UK and the Republic of Ireland, His Excellency Papa Owusu Ankuman. It may interest you to know that he just assumed duty. He actually reported for duty on Monday, and this were one of the invitations he was anxious to honor, but then he has a stable... He has a stable piled up. Sorry, I was experiencing some feedback from your side, sir. He has his table all piled up and decided to let me take part and speak on his behalf at the Second Epilepsy Alliance Africa Conference 2021. At the outset, let me take the opportunity to commend the organizers for organizing this year's event, as it tends to address an essential health and well-being aspect of the lives of men, women, and youth worldwide living with epilepsy, but most notably in Ghana during the COVID-19 pandemic. Distinguished ladies and gentlemen, as you all know, epilepsy is a chronic brain disorder that briefly interrupts the regular electrical activity of the brain to cause a person's seizures. In Ghana, approximately 31.4 million people, about 270,000 persons live with epilepsy, with a few who have access to treatment and care, sadly. This is mainly due to cultural beliefs, lack of understanding and misconception of the disease, inadequate workforce and capacity, accessibility, absence of national policies, high-level stigmatization and funding. It is sad to say that most people who suffer from this disease are primarily found in remote areas of the country. In Ghana, cultural beliefs and misconceptions about disease and prevalence leads to stigmatization of people living with the disease. This stigmatization is mainly based on myths and beliefs about contagia and spiritual afflictions, which often results in discrimination and indirectly affect the quality of life of the people living with the disease. The people living with the disease are mostly refused education, employment, marriage, and may even be separated from the family, which consequently leads them to conceal their disorder and avoid seeking medical attention, sadly. May I at this point share an insight on the ways to address lack of service to epilepsy patients, particularly in Ghana. Firstly, to my mind, we must integrate epilepsy management into our primary healthcare system by regular training and supervision of primary healthcare workers. Secondly, we must increase public awareness campaign through the various media platforms, community sensitization programs through churches and schools in order to educate people on the existence of the disease and reorient them to reduce misconception about it. Thirdly, there's a need to strengthen the health information system. This would help in early detection of the disease, as the primary healthcare worker would have first-hand information about the patient's condition. Distinguished ladies and gentlemen, may I also highlight how Ghana has worked to some extent about the epilepsy stigmatization. In 2012, the Ministry of Health of Ghana, with the support of World Health Organization, launched the fight against epilepsy in the then 10 regions. Now we have 16 regions in the country. Subsequently, several activities were implemented to integrate epilepsy care into Ghana's primary healthcare system and to help combat stigmatization mainly. The foremost of this strategy was developed for the delivery of epilepsy care. Under this, a national coordination committee led by Accra Psychiatric Hospital, in conjunction with Ghana Health Services, Ghana Medical School, and non-governmental agencies like Basic Needs Ghana, were set up. Secondly, health workers and volunteers were trained as it forms an essential element in integrating epilepsy into primary healthcare system. Specialists like neurologists and psychiatrists were trained to become trainers and supervisors in epilepsy management. General practitioners and nurses were also trained to diagnose and treat the disease. In addition, community healthcare workers and volunteers, including traditional and faith-based healers, midwives, teachers, and non-governmental organization staff, were trained to detect potential cases to assist in acute seizures incidences and refer patients for further medical care. Thirdly, there's been awareness raising campaign and education of communities so far. A communication strategy such as the various media platforms mentioned before, including community derbers, outreach services, were adapted to disseminate information to encourage people to seek medical attention. Again, as I have mentioned earlier, people in Ghana strongly believe epilepsy is a spiritual ailment, sadly. And therefore, their first point of call is the traditional and faith-based leaders instead of the medical experts. Under this initiative, there's been an engagement with the community, traditional and faith-based leaders to create awareness and to help them also reduce the stigmatization. Lastly, Ghana has outlined policies to strengthen and monitor and evaluate systems that were developed and implemented from 2012. This includes new patient forms, follow-up patients forms and facilities. This helps monitor the progress of the services provided and patient outcomes and supplies of medications. May I conclude by congratulating the organizers once again for putting together this very useful and important program, and to invite all present to support this worthy cause and spread the news to help reduce the stigmatization associated with epilepsy. Thank you.
Thank you. Thank you very much, Minister Bediako Puni, for words of encouragement and also detailing what is happening in Ghana at the moment.